Y'all, if I can tell you how aggravating it is to record in landscape and be focused on where the camera is, it's so aggravating. But anyway, I have a treat for you guys. So, oh my God, I went and picked up my husband's medicine today. Let me see if not them. Oh my God, putting the whole stick up. Hold on, let me. Ooh. All right, so here we go. I got to take the tag off of his name because it's covered a whole box of sticky stuff. Y'all see that? So I had to pick up his medicine today, the Ozempic that has been out for months. So what we discovered dealing with I think they have been out for almost a year at CVS. Kroger's have them. Kroger's have them, but they only have them in 2 milligram increments only. Deliver dose in 2 milligrams. So, but my husband was on 1 milligram, and I did not give it to him all the time. So the other day, I brought some golden grams because I've been having cravings because my daughter is pregnant. So I think it's called Kovas syndrome, where you feel the pregnancy stuff of, either your child or your mother, your spouse, or whatever, your partner can feel the symptoms as well, or something else they call it as well. But I've been getting weird cravings. This is how I knew my daughter was pregnant. That's another story for another day. But he went and trusted to go eat the golden grams. And I was just thinking to myself, why is my golden grams so low? I thought one of the twins ate it, but it was him. So eating that with milk send his sugars up to 400. I go and look for the last pen that we have, which I just kind of been savoring. I don't give it to him every week because this stuff is dangerous. I want to tell you. So I go look for the pen. Apparently, it dropped out of the refrigerator, landed on the floor. The dog chewed the end part of the push part, and I had to chuck it in the trash. It was half left. I had to chuck it. So, because we could not get the 1 milligram, we had to get the 2, because 1 milligram is nowhere to be found. Because y'all people out there, I want to say y'all, people who taking Ozempics who ain't supposed to, is getting sick and trying to lose weight because you ain't got no sugar issues. But when you have sugar issues, when you have your AC3 is high, and when you have your high glucose and you need to take this, it is definitely for the people who have diabetes and have issues with diabetes. I will say this is probably the best thing that you need to get your sugars low. This work, he has no issues, no stomach issues, no throwing up, none of that stuff, because it's doing what it's supposed to do, which is drop your sugars and make you go to the bathroom. This is doing what it's supposed to do. But when you don't have issues, when you don't have sugar issues, and this is working like it's supposed to work, your body then, say, hey, there's nothing wrong with me. Why am I taking this? That's one of the reasons why a lot of y'all get sick with taking this. However, so the doctor basically said, if you don't have 1, we're not putting him on anything else because this works. We're going to do 2, you need to have it. I asked the lady at the pharmacy, I said, listen, what is half of the click? She's about, you can't do half of the clicks. You got to do the whole 2. If you can't do the whole 2, then they need to dumb down the doses. Y'all don't have the doses that I need. That's the reasons why we are out here getting 2 doses, because everybody want to get 1 dose to take for their shondo so they can lose weight. So I'm sick of I'm sick of it. And I can honestly tell you, how many come in a box? I think it's only one come in a box. I'm thinking the other ones, the other insulin, you get like, they give you about 10 dang on sticks of insulin in the other box. So, you guys, I'm just opening it, and it already comes preset with all this information, and I'm just taking, I don't know why I'm taking it out. I got pens from other stuff too. And see, it is color coded actually different, because the ones that are one is like purplish color, but I guess this is the warning that is, for single patient use only. So 2 milligrams increments only, to 8 milligrams, 3 milliliters. So a pre-filled pen. So the dog had chewed this part right here. The push button was gone. I could still click around, but I had nothing to push to inject the insulin. So I had to just trash it, and I was just pissed because I had to trash it. And I'm like, listen, I need this insulin. So what I had to do, I basically had to water him down and cinnamon peel him, and basically be like, don't you go in there and eat nothing else. Don't go in there. He be like to go in there and eat sandwiches and stuff like that. And what it is driving the sugar up. When your sugar drops low, and you drink milk's supposed to help raise your sugar, because it has like something like sugar in it as well. So, just word of the wise, you're diabetic, you should not be drinking sugar. You should not be drinking milk. You should be drinking an alternative to milk, because it does raise your blood sugar up as well. So if you had issues with, and the only thing I'm just trying to do is prevent another stroke. I'm trying to prevent the aneurysm that he got in his freaking eye from getting worse, and all those other type of things that we got going on. So I'm just kind of, in this situation where I'm just kind of like, and my Starbucks help today. Okay? It's giving me life today. It's giving life. Definitely giving life. So, again, this Ozempic, 2 milligrams. We're not going to use all the 2 milligrams. We're gonna half this. He actually takes one. He was supposed to take 1 milligram. We're going to have this. And I think the lady, I'm going to call the doctor's office, and I think she said 36 clicks. I think half is 36 clicks. Or I'm going to half it to 12 clicks. Because whatever it's going to be less than what this actually is prescribed. So it's going to last longer. But the last time we got this, I kept these for almost like maybe 6 months to a year. Like, I had stuff left over. And I had to actually toss some of it away, because we done had it so long. It's like I was running a medicine shop of how much insulin I had. And I'm not a big fan of insulin, because what it does is it forces your body to act right, when it forces your pancreas to release what it needs in order to release the sugar that it needs to regulate your body, or whatever the case may be. I don't know the details. I don't like insulin, because when it forces your body to have to get rid of the sugar and the excess and all that other kind of stuff, but it also messes up your kidneys. So he's at stage 2 of EDK, or it's end-stage renal disease. And in order to prevent that, your sugars need to constantly be down. Sugars need to be constantly down, because he has a leaky vessel in his eye because of diabetes. So we're basically just trying to prevent all these things from happening. And it's definitely just a task. I want to say, if you're on Ozempic and it's not what you're using it for weight loss, please don't do it. Please don't mess up your system. Or learn to, once you on it and you have lost weight, get off of it and learn how to maintain without utilizing it, because that weight will come right back as soon as you off Ozempic, and it's messing up your pancreas. I'm just saying, that's my point of view, my 2 cents. Okay, all right. This is not for the faint of heart at all. So you want to be very, very mindful. Okay, all right.